Folks, good morning. Today we're going to discuss one of the most important COVID risk factors we basically hear nothing about. It turns out that what we're going to talk about today is self-inflicted. It's a COVID risk factor that's caused by people's lifestyle choices. And believe it or not, the COVID risk factor we're going to talk about today causes the U.S., the world's richest nation by far, to suffer more deaths and infections per capita than even the poorer nations. Now, what could that be? I hope I've got you curious now. Well, that risk factor, men and women, is obesity. There are literally hundreds and hundreds of studies that show that obesity is a very, very big risk factor for COVID virus infections and deaths. It's number 2 after old age. The more obese you are, the more the virus infects us. Listen to this. Obese people have triple 3 times the hospitalization rate from the COVID virus as normal weight people. They have 75% greater chance to end up in intensive care in a breathing machine. They're 50% more likely to die than normal people. And surprisingly, and they haven't got this figured out yet, but the deleterious effect of obesity in the COVID virus is even seems like it's accentuated greater in people under 50. Nobody has any explanation for that yet. But the fact is that today, almost all virus deaths are caused by obesity or older non-exercisers. Now, and Wes, you may want to chip in on this. Why does obesity drive bad virus outcomes? Well, we know that obesity is linked to a very seriously impaired immune functions. And of course, bad immune functions lead to severe and deadly virus complications. Now, why would it be, I'm not enough of a scientist, Wes, why would it be that obesity is linked to impaired immune functions?
Well, one of the things that we see with especially visceral obesity, which is the deeper fat around internal organs, it stems largely from inactivity and a highly processed diet. But that type of obesity is associated with a high level of immune cell infiltration. The immune cells get into the adipose tissue and then they release like a flare gun signal of cytokines that recruit more immune cells to the area. And it leads to a chronic state of inflammation throughout the body. And the inflammation we know is really at the foundation of many, many chronic diseases. When your body is in a chronically inflamed, even low-grade inflammation state, cancer cells are an environment for them to thrive and grow. Blood is more likely and more easily to clot. The effects that we see through the oxidative stress and everything on blood vessels and whatnot, blood vessels even get stickier in an inflamed state. So we see heart disease and neuronal degeneration with inflammation, and the list goes on and on. But one of the major complications of this novel virus, this COVID-19, the SARS-CoV-2 virus, is a cytokine storm. So when individuals have higher levels of these inflamed storage sites of fat that are producing cytokines already, the cytokine storm increases dramatically. In addition to that, the lack of exercise in these types of patients increases low-grade inflammation as well. With every bout of exercise, we see a decrease in inflammation. There's an anti-inflammatory effect of exercise, and that's the protective effect. One is direct through literally a direct anti-inflammatory effect of every exercise session. The other is indirect because of the loss of visceral fat that occurs with exercise. They've even identified a switching that occurs in the type of macrophage that is embedded in the adipose tissue from exercise. So macrophages, which are big Pac-Man-like phagocytic immune cells, macro means big, phage means eat. They're like literally immune cells that are big eaters. The macrophage type that tends to be in a sedentary person releases more of these cytokines that are linked to this cytokine storm we see with COVID-19, severe COVID-19 infection. But through exercise, they see a switching of the macrophage type that produces less less of these cytokines, and at least they see these in animal studies, which tends to suggest some of the benefits of both weight loss and exercise in combating obesity and severe COVID infection, perhaps at the same time. And
now, we've been talking about why is it that obesity drives these bad virus outcomes, and we talked about the obesity leads to impaired immune systems, and you've explained that. We also are beginning to see that obesity leads to lower vaccine responses, which struck me as a little unusual. Fewer antibodies, the vaccines just are not as effective in obese people. Now, the next question is this: if obesity is a big problem with the virus, how common, how serious is obesity in the US today? US citizens are 70% overweight. 70%. They're the most overweight of any citizens anywhere in the civilized world. And the fatter you are, the worse the virus problems are. The fatter you are, the more chance of hospitalization and death. And it's getting worse. We're seeing a greater obesity prevalence now among the young. And of course, during the lockdowns, there's now data showing that this is hard to believe that the average person during lockdowns is gaining 20 pounds. So obesity is really coming at us big time. And we do know the death rate would be far, far lower absent the obesity epidemic. Now, that makes me make a statement that I'm a trial lawyer, and sometimes I get accused of overstating things. I believe that today, obesity is the largest single health problem in America by far. And Wes, it might be the largest problem of any kind because it's so dangerous. Medical science is now agreeing that we need a national anti-obesity campaign. We needed it before the virus, but now we really need it. We know that obesity is a big driver of the chronic diseases that kill us. 7 or 8 kinds of cancer, heart disease, Alzheimer's, diabetes, etc. And a leading American scientist, politician said last week, we cannot, I'm reading this now to be sure I get it right, we cannot have the current level of obesity because it will literally cripple our nation. Now, why is it, if this is known to medical science, if medical science wants anti-obesity campaigns, if it's causing all these problems with the COVID virus, ruining our lives, how come we don't have any anti-obesity campaign? How come the federal government doesn't point out to us that it's killing us with the virus? It's killing us with chronic diseases. Well, the problem is this, I believe. We rely in America on doctors to cure diseases, not to prevent them. And the American Heart Association has said there's a huge medical school failure to teach the kinds of things you and I have been talking about today. They just aren't taught. And doctors admit, this is from the American Heart Association, they don't know enough of what we've been talking about today, even to advise us what to do about exercise. You're in a med school, Wes, your med schools and others are the ones being accused of not teaching this. What's the story? What can you tell us? You're an insider.
Well, yeah, there's a lot there, Fred. That's a really, some good points that you raised. And I would say that for one, the way we measure obesity in terms of it being dangerous, we have to kind of reconsider in some ways, because there's a difference between metabolic obesity and just having a BMI over 25, for example, which puts you in an overweight category. So I know you're a big advocate of monitoring strength. If we looked at that as an actual vital statistic and other elements of physical activity as a vital statistic in a clinic. So instead of a patient walking in and getting their height and weight measured, their BMI, boom. If let's say someone is 5'10" and 185 pounds, most people would look at that person, not consider them overweight, but their BMI would put them in the overweight category. It'd be over 25. Now, if that person said, unfortunately was diagnosed with cancer and had lost weight, their BMI would actually move them into the good range. And we would say, oh, look, your BMI is better. But the reality is they lost, strength and muscle. And even though their BMI improved, their overall health didn't. And this was a concern. So if we had a strength measurement, we would see that their BMI went down, but also their strength went down. That's not a healthy weight loss. So when we categorize body composition, there's ways of doing it. Like, I'm a big believer that simple waist circumference, just waist to hip ratio is important, waist to height ratio is important. But even if we just got waist circumference right over the belly button, we know that a male with a waist circumference over 40 inches, a female with a waist circumference over 35 inches has an increased risk of metabolic disease and cardiovascular disease. It's a very simple measure. We also know that the metabolic obesity, which is simply that centralized obesity with the visceral fat, is a key component of a pre-diabetic state. Right now, we have 1 in 3 Americans.
Some of our listeners may not know what visceral fat is. We've used this twice. Yeah. It's true, isn't it, that fat on your butt, fat on your thighs, that's subcutaneous fat and not visceral fat. And visceral fat is fat that's on the inside of your belly, entwined with your intestines and kidneys and all your
internal organs, and it gets oxidized. So basically what happens is it becomes rancid. It's rancid fat that gets inflamed, and it's the most dangerous fat. We know this from numerous studies that is the fat that we're trying to prevent, and we can estimate it from waist circumference. And the reason why it's important is that abdominal obesity and that pre-diabetic state that I was talking about, we see that about 1 in 3 Americans are at risk for diabetes because they fall into the metabolic syndrome category. And about 1 in 2 minority Americans. And diabetes, as we know, is the leading cause of a lot of comorbidities like blindness and limb amputations and kidney failure. So this is a major public concern, but we shouldn't just take everyone with a BMI over a certain range and just classify them as being obese or non-obese. We really need to look at metabolic related obesity, because metabolic related obesity is the one that is linked to a lot of the things that we're talking about here.
So the last subject I'm going to talk about, and we'll treat this quickly. Everybody says to me, everybody tells me I got to lose weight, but I can't lose weight. Okay, we know obesity is terrible. We know it's killing us. We know it's giving us the virus. We go on and on. What do we do? Well, what I believe is that telling somebody to lose weight people like positive motivations. Losing weight is a negative thing. I'm too fat. I got to lose weight. I've been told that my whole life. I know it's hard. What we teach is just focus on getting stronger. Focus on working with weights and high intensity aerobics training and get stronger. If you focus on strength, weight loss will come. I've got several people I've been working with for a couple of years, and when people forget about all this, I got to lose weight, I got to diet, I got to do this, and just think about strength. Pretty soon people start saying, oh, you're looking better, Helen. And then Helen feels better and Helen works out harder. And gradually over a year or two, you get their weight normal. And when your weight gets normal through a normal, healthy course like getting stronger, it's going to stay that way. Well, I hope we covered everything, Wes, and we thank again everybody for listening in to us. And I'll see you in a couple of weeks.
Thank you, Fred.